Okay guys, so today we're going to talk about our next video, which is we're going to talk about your T cells and cell-mediated immunity. Okay, so first let's talk about the origin of your T cells and how they mature. So the origin is going to be your bone marrow, but to mature your T cells, we require the work of the thymus. So we remember the thymus is an organ that's part of your lymphatic system. It's located in the superior aspect of your chest cavity. So the thymus, when you're young, works fairly robustly, but after puberty starts to kind of atrophy, and with age continues to atrophy. Okay, the thymus is going to allow for this maturity by secreting two hormones that will allow your T cells to become what's called immunocompetent. And so then they can go ahead and do the jobs that they were intended to do. So there are different types of T cell populations. Okay, so I'm just going to talk about that and then focus in on the cells that are of critical importance. So we have different populations of T cells. Okay, so for example, you have T helper cells, T killer cells, okay? You have T suppressor cells, and then you have T memory cells. Okay, so each of these, and I'm going to just give you a quick kind of alternate language for these two. So these are sometimes referred to as CD4 cells and CD8 cells. Okay. So what do these different populations do? Well, these clever names tell us exactly what they do. T helper cells are going to help all aspects of your immune function. So not only will it help the T cells, but will also help the B cells in carrying out the jobs that they need to carry out as well. So the T helper cells are really a linchpin in your immune system. They're critically important, and I'm going to talk about what happens when those cells are compromised. T killer cells do exactly what they say they're going to do. They go after and kill other cells, kind of in a cell-to-cell combat. Okay. T suppressor cells suppress your immune system's reactions and suppress the actions of other T cells, which you need to happen because you need some sort of control over the whole thing. If you just let the T cells kind of run around unchecked, that's not a good thing. We need to have balance. So the T suppressor cells help us achieve that balance. And then your T memory cells are cells that can remember from one encounter to the next. So that, again, remember your adaptive immune system, one of the key features of it that's extremely important is that it has memory. So that if it encounters an antigen again or an issue again, it knows exactly what to do. And again, with a more robust reaction than usually the first time that you encounter that particular antigen. So I'm going to spend some time talking about these cell populations and what happens when they're compromised. Okay. So when someone has HIV, so HIV is a virus. AIDS is the condition resulting from the virus. So we're not going to focus on that too much. We're going to talk more about HIV. So HIV is a virus. We all know that a virus needs a host. The host cell for the virus is the CD4 cells. So this virus preferentially likes to hijack this particular host cell and then use it to do the viral work that it wants to do instead of doing what the host cell work is. Okay, because these helper cells are of critical importance to all aspects of your adaptive immune system, if the virus is taking over these cells then cannot do the work that they are supposed to do. And so what happens when someone has HIV is their CD4 and their CD8 cell counts actually decline as their viral load increases. Okay, so as one is going up, right, your viral load, the number of healthy T cells is going down because they are viral infected. So what happens is when someone has HIV and you flip the switch to AIDS, now you have a very high viral load and a very low number of healthy T cells. Okay, so as viral load is increasing, the number of healthy T cells is decreasing. Well, if you decrease the number of healthy T cells and they're taking care of jobs like helping other aspects of your immune system to function, or in the case of the CD8 cells, they're directly attacking and killing other viral infected cells. So what happens when someone has HIV is they become severely immunocompromised, right? So when someone is immunocompromised, what that tells us is the normal actions of their immune system have been compromised. They're not going to operate appropriately. And so because of that, what happens when someone progresses to AIDS, they develop what are called secondary infections. So oftentimes you'll hear someone with AIDS dying of something like pneumonia, okay? But they are impacted by certain viral things that normally your immune system is really not impacted by because it can kind of handle it. Something like cytomegalovirus and things of that ilk. So usually the patient dies of secondary infections and would also experience things like weight loss, muscle wasting. A lot of HIV, or I should say AIDS patients develop, it's called Kaposi sarcoma, which is they look like purplish brown lesions under the skin. That is a type of cancer that for most people it does not impact them. It's very rare to see someone with Kaposi sarcoma that isn't immunocompromised. Okay. The treatment for HIV, the goal would be to try to keep the viral load very low and the number of healthy T cells higher. So we're not curing someone of HIV, but we are treating them for HIV. You take a cocktail. It's called ART. It's antiretroviral therapy. Okay, and this is a cocktail of drugs. Those drugs may include things like a protease inhibitor. Okay, a reverse transcriptase inhibitor. Okay, so there's several different drugs that are kind of mixed into this cocktail, and then the patient has to take the cocktail theoretically for the rest of their life. Okay, one of the side effects for the cocktail, there are many, many side effects, but it can cause liver damage with long-term usage, or it can cause damage to your liver. One of the other issues associated with your immune system is when I had said before in the last video that you have to be able to successfully understand, your immune system has to successfully understand the concept of self versus non-self. And I said sometimes your immune system isn't successfully able to do that. So for example, when we have failure to recognize or something where those recognition peptides, your immune system sees them as not you. Okay, so when someone has an autoimmune issue, autoimmune diseases, which there are many different types of autoimmune diseases. I'll give you a couple of examples. Things like rheumatoid arthritis, plaque psoriasis is autoimmune. Type 1 diabetes is technically autoimmune. Graves' disease is autoimmune. Myasthenia gravis, scleroderma. So there's several different types. Generally speaking, lupus is another one. When someone has an autoimmune disease, their immune system kind of fails to identify self versus non-self. And what I mean by that is your immune system sees self as non-self, and produces what are called autoantibodies, antibodies against your own tissue. So we know that we produce antibodies normally against an antigen, but now we're producing them against yourself, okay? So the way that certain autoimmune issues are treated is some of them, for example, type 1 diabetes is treated because of the outcomes. The outcomes of type 1 diabetes would be that your patient doesn't make any insulin, so we have to address that first. But something like rheumatoid arthritis, the way that it's addressed is you take a drug that will inhibit immune system function in some way. So for a long time, people took corticosteroids like prednisone. But now you see things like Enbrel or Humira. Those are leukotriene receptor antagonists. So they're a little bit different way of kind of calming down the immune system so that it doesn't continually generate these autoantibodies and cause tissue damage, okay? So there are different types now of drugs that treat autoimmune diseases that have a little bit better outcomes in terms of side effects. Prednisone has many side effects, and so is not really a great treatment option, especially for long-term treatment. The other thing that can be used in the case of lupus is something called Plaquenil, which is a hydroxychloroquine type drug, which is used. It's an anti-malarial drug, but it shows to be effective in treating lupus. Okay. So, all right, so let's talk quickly about organ transplants. Okay, so you need a new kidney, so you call up your brother or sister or whomever and hope that they still like you enough to donate a kidney, okay? So first thing they do, they don't just put the kidney in, right? They have to do histocompatibility. We have to make sure that that donor is an appropriate match, and we're gonna just assume all of that happened and it went well, okay? Organ transplants are also called grafts. So we think about a graft of tissue or an organ, okay? There are 4 different types of grafts. You have an autograft, which means you took tissue from yourself and relocated it someplace else. An isograft is that from an identical twin. The one from your brother or sister is an allograft, which means it's coming from the same species. Or you can have a xenograft, which is a great word, which means you're taking tissue from another species that is shown not to be rejected, hopefully, by humans, okay? So let's say we get our graft and we get our new kidney, okay? So what we would want to see is a high degree of overlap in those receptor proteins to make sure that when your body takes in this new organ, it's not going to out and out reject it. So oftentimes people who receive organ transplants will have to take immunosuppressive anti-rejection drugs. So because most anti-rejection drugs are immunosuppressive, they suppress the immune system so that it doesn't kick your new kidney to the curb. This unfortunately opens up then the opportunity, because the patient's immunosuppressed, it opens up the opportunity then for them to be subject to infection, and they're at risk for infection. So that certainly becomes something that has to be monitored as well. So that's going to do it for our immune system. Our next set of videos will be your digestive system.